Good afternoon. Today we're going to discuss your IV priming as part of your nursing skills. Aside from IV priming, we will also discuss a little bit about your titrating, reading, discontinuing, and troubleshooting. In the case of IV priming, what does it mean? IV priming is when you place the IV fluid here on your right into the tubing of your IV line. In this case, we will try to prevent any air in the IV tubing before we're going to connect that to our patient. What is the importance of why we need to make sure na walang air or hangin sa IV tubing natin bago makapasok sa katawan ng pasyente? This will now prevent what you call your air embolism. If your body or if the air will now reach around 10 cc, pwede na siyang or it is already enough to create what you call an air emboli. Imagine niyo dun sa blood vessel ng pasyente natin, merong hangin. So in between dun sa blood vessel, walang blood kasi hangin ang meron dyan. If it will reach the heart of the patient, it can lead to the stoppage or pwedeng tumigil yung heartbeat ng pasyente natin. The patient can eventually die. So this is what we're trying to avoid when we're doing your IV priming. Another concept would now be your IV titrating. It would now refer to adjusting the medication or the fluids that will now drop or go into the patient's blood vessels. So in this case, ginagamit natin dito yung roller clamp natin in order to make sure na may certain amount lang of fluid na nakakapasok sa pasyente natin. That is why you would also notice nurses would usually go to the IV of the patient and then they're going to count the number of drops. Yung ginagawa natin dito is to titrate, ensuring na sakto yung pumapasok sa pasyente. So you're going to count number of drops for every minute. Next would now be your reading your IV bag. In reading your IV bag, take note, mas madaling magbasa ng IV bag kung ilang amount of fluid ang naiiwan dun sa mismong IV bag natin. Pag plastic bottle or yung mismong glass bottle, yung IV bag natin na ginagamit. However, there are some instances na non-collapsible bag yung ating IV fluid. In the case of your non-collapsible IV bags, we will have to roll sa taas ng IV bag para mabasa natin kung ilan ba yung amount of fluid. Meron niyang mga demarcations that will now show us kung ilang IV fluid ang naiiwan. Pag bottle, basahin mo lang kung saan dyan nakalagay yung mismong tubig, dun na yung level ng fluid. In the case of a non-collapsible IV bag, you're going to have to fold yung top part para makita ninyo kung saan yung mismong level ng IV fluid natin. However, we also have what you call your collapsible IV bags. In the case of your collapsible IV bags, hindi mo na kailangang i-pinch or i-crumple yung top part ng ating IV bag because kusang yung IV bag mismo yung nag-push down dun sa tubig. So you're just going to read yung mismong level ng tubig na yan. So those are the types of your IV bags. Another, if you're going to look into your discontinuation naman, if for example, hindi na kailangan ng IV fluid, we will now discontinue the patient's IV line. We also have here your troubleshooting. If we encounter some problems dun sa flow ng IV fluid dun sa katawan ng pasyente natin or sa mismong IV site ng pasyente natin, that's the time we're going to troubleshoot. Kumbaga, aayusin natin yung problema dun sa flow of fluid. Now let's go to the different basic parts of your IV line. In the case of your IV bag, you would usually see here, this is an example of a non-collapsible IV bag. So we have here on the top part, usually you would see the expiration date ng gamot. We also have here yung pangalan ng mismong IV fluid natin. So for example, if you're going to check the doctor's order, 0.9 sodium chloride or plain NSS ang ibibigay natin for 8 hours. So in this case, you're going to make sure na pareho yung nasa medication order tapos yung nakuha mong bag. Even before you go to the patient, i-recheck ulit natin yan, tapos kukuha pa tayo ng medication or IV label natin so that we will be sure kung kailan natin hinook yung medication, kailan natin binigay yung IV fluid, ilang drops ba dapat yung binibigay natin per minute. In your IV bag also, you would take note of two separate attachments. The first one, the one with the blue plastic, is known as your administration set port. Dito natin dinidikit or dito natin ina-attach yung spike ng ating IV tubing. So in this case, ito yung dinidikit natin. The other one, on the other hand, is what you call your medication administration port. There are some instances na nagmi-mix tayo ng gamot mismo sa IV bag para ma-dilute yung gamot. There are also some instances na yung medication administration port natin ganito ang itsura. So dito nyo mismo nilalagay yung gamot. And then dito yung attachment ng ating spike so that it will now go to your IV line. We have here your parts of your IV tubing. The first one is your spike, the bag spike. Ito yung matulis na part ng ating IV line na dinidikit natin or ina-attach natin sa IV bag. In this case, of course, normally it is placed on a plastic bag. You're going to open it up and then pag tingin niyo sa bag spike, meron niyang plastic. So, it is covered by plastic to ensure the sterility of the bag spike. Kailangang sterile yung bag spike natin pag dinidikit natin sa IV bag. Isungahan yung agaguman dyan mismo nga spike. So in this case, we also have here below it, we have what you call your drip chamber. Your drip chamber is where we're going to put IV fluid muna before we're going to prime the IV line. In this case, the drip chamber will help us see kung ilang drops ang nakukuha natin every minute. So ito yung mismong binibilang natin. Aside from that, we also have here what you call your vent, your air vent for your IV line. In your air vent, it will facilitate the movement of your drops down into the IV line. If we encounter problems with our drop rate, you can open your air vent. And of course, we have here your IV line. And in your IV line, you will see what you call your roller clamp. Your roller clamp is the one that will now help regulate the drop rate of our IV fluid. So in this case, if you pull the roller clamp down, if you pull this part down, sa baba, what will happen? Iipitin niya yung IV tubing, kaya magsa-stop yung flow rate natin. Pag tinataas naman natin yan, sa pinakataas, bibilis naman yung drop rate natin. So ito yung ginagamit natin in order to control the drop rate of our medications. Aside from the roller clamp, we also have what you call your slide clamp. Your slide clamp will simply open and close your IV tubing. So pag kailangan nating i-close muna yung IV line natin or yung drop rate natin, hihilain nyo lang dun sa may narrow portion ng ating slide clamp. If you want to open it back, you're just going to push it back and make sure the IV tubing is within the wider part of your slide clamp. Next would now be your injection port. Your injection port is also a part of your IV tubing. It is where your medications may be given through IV push. So, meron tayong mga syringe dito na may gamot and then nag-IV push yung nurse natin dyan. Dinadiretso yung gamot dyan. Aside from that, pwede rin tayong magkaroon ng second line or your secondary line or your piggyback. Your piggyback, it is also known as your side drip. Kabit. Ayan. Ito yung primary IV line natin. Ito yung kabit ng ating primary IV line. We call this your side drip or piggyback. In this case, para siyang maliit rin na IV bag with IV tubing but it is connected to your main line through the injection port. So may needle actually yan na dinidikit natin dyan sa mismong injection port natin. So these are instances kung saan may mga gamot tayong 500 ml, 200 ml na kailangang ibigay sa pasyente natin together with the primary IV line. So those are the basic parts of your IV set. Also, I forgot this one, meron tayong needle end. At the end of your tubing, ito yung dinidikit natin sa mismong cannula ng ating patient's IV site. So in this case, the needle end is also covered by another plastic in order to maintain the sterility of the needle end. So in this case, this needle end and the bag spike should always remain sterile because that will come in contact with the blood of our patient, which should be naturally sterile. Ayan. So again, ito yung setup ng ating primary line with side drip. Ito naman yung regular na setup ng ating IV line. We have to hook our IV bag onto a pole so that gravity will start pulling down the fluids down to our patient. We will now proceed with the actual procedure. The first thing to do, of course, is to perform hand hygiene. In performing your hand hygiene, you would either wash your hands with soap and water or use your alcohol. This is to prevent contamination of your IV bag. Next would be to check the physician's order for the type of solution we will be infusing to the patient, the amount of solution we need to infuse to the patient, and also the dosage of any medications that will be added to the solution. Aside from that, some physician's orders would also indicate kung ano yung flow rate natin or drop rate of our infusion. However, kung wala, sometimes nilalagay na lang nila would be the amount of time it should be consumed. After checking the physician's orders, please take note always in the chart, you have to check the physician's order sheet. Hindi yung sa may medication sheet kasi sometimes yung nagtatranscribe or yung naglilipat ng order ng physician to the medication sheet is actually a nurse. So it's best kasi malay natin baka napuyat kaya iba yung gamot na nilagay or baka nakalimutan ilagay. So in this case, you have to check first, pinakauna ay yung physician's order. You have to ensure also that the order is for the patient. Next would be to prepare all the necessary materials or supplies for your IV infusion. These are your primary IV tubing, IV solution, and we also have here your IV tag or the label. In your IV solution, usually they will come either in your collapsible or non-collapsible bag, or they may also come in your bottles. For your bottles, they are actually much easier to read compared to your bags. In some bags, they are also covered with plastic and also your IV tubing. Your IV labels will also be available in the nurse's station. You have to ensure that you write the right patient of the name, the room number, the actual infusion, kung anong type of solution ang ibibigay natin, for how many hours, or kung ilang drop rate natin. And you should also indicate kung kailan ninyo hinook or kailan ninyo na-start yung mismong infusion ng ating medication to our patient. Next, we also have here, step 4 is to remove the IV solution from the outer packaging and gently squeeze the bag. For your bags, you have to gently squeeze it. Why do we need to do that? In order to ensure na walang butas. Kung may butas, of course, you have to change it. Then you should also remove the tubing from the bag. And eventually, you're going to straighten it out. And next, you have to move the tubing clamp or the roller clamp along the tubing until it is just below the drip chamber. So ito, you're going to put the roller clamp very close to your drip chamber hanggang dyan. Or at least 3 centimeters below the chamber in order to facilitate its access para mas madali nyong makita yung drip chamber and at the same time yung roller clamp. And then you're going to slide the roller down para mag-close. Next would be to leave the ends of the tubing covered with a plastic cap until the infusion is started. So in this case, yung ends ng yung end cap ng ating tubing should still be in place. That is to ensure na hindi makakontaminate ang ating end of the tubing. Next would be to expose the insertion site of the bag. So in this case, yung blue na plastic na nakikita nyo usually in the case of your bags, you will have to remove that. Kasi yan yung protective covering niya to maintain the sterility of the inside portion of your access port. Next then is to remove the cap also of your spike. Diba, sinabi ko kanina, may plastic yung spike in order to maintain also its sterility. Make sure you do not touch the spike with your bare hands. And then, you're going to get the other end of your IV solution and put your spike into the access port. So you're going to gently push and at the same time twist the spike onto your IV bag. So just like this one. It's very important that you should be very careful kasi again, maintain sterility of the spike and also your port. After you were able to insert the spike into your infusion bag, you will now hang the solution container on the pole and adjust the pole so that at least the bag should be suspended at least 1 meter above the patient's head. This elevation of your IV bag or IV solution will facilitate the movement of fluid into the patient's blood vessels through gravity. Next, you're going to squeeze the chamber. You're going to squeeze this one and make sure that the drops or the fluid will eventually flow down, filling the chamber 1/3 to 1/2 full. The filling of your chamber 1/3 to half full will prevent any air from moving down the tubing. Kasi pag walang laman yan, pwedeng hangin ang makakapasok sa mismong IV tubing natin. And again, we mentioned a while ago that we're trying to prevent any air embolism. After filling in the chamber of the IV tubing, we're now going to remove the cap of the ends of the tubing and make sure to direct it towards a container. So itong tube na yan, meron tayong kidney basin for example, or kung malapit tayo sa sink, you can direct the end of the tubing on a sink. And while you're doing that, you're going to release the clamp. Kasi nasabi natin kanina, clinose natin, nakababa yung roller ng clamp natin. You're going to push the roller up para mag-release yung flow ng water or ng fluid. The fluid will then move downwards until it goes to the ends of the tubing. The fluid will now move out of the ends of the tubing, and then that's the time you're going to lock again or you're going to reclamp the tubing. So in this case, ang magiging labas nun, mapupuno na ng fluid yung mismong tubing. You also have to inspect your tubing for any air. If you see air in the tubing, reopen the clamp until maging okay na yung tubing. However, pag sobrang malayo naman yung air, you can actually just start hitting or pipitikin natin yung mismong lower end ng air na yan so that it will go up into the chamber para mawawala yan. I will just show you a video on how to do that. And then next, for your troubleshooting naman. For your troubleshooting, usually, paano pag hindi maganda yung flow ng ating fluid? In this case, you have to make sure to avoid any kinks. What do you mean by kink? Nagkakabuhol-buhol pala or naipit pala yung mismong IV tubing. Minsan nadadaganan ng pasyente or sometimes bigla na lang nagfo-fold or nagtutwirl yung tubings. So make sure na straight pa rin yung ating tubing. Aside from that, we also have here ensure na mataas or at least meron tayong 1 meter elevation from the client's head dun sa IV solution natin because we need the gravity to pull the fluid down into the blood vessel of our patient. If you notice, pag binababa natin yung IV bag kasi, hindi yan magpo-flow dun sa blood ng pasyente. Ang mangyayari dyan, yung dugo mismo ng pasyente pupunta dun sa IV bag. Aside from that, avoid any air bubbles. Take note, at least 10 cc of air that enters the body can actually be enough to create what you call an air emboli, which can then stop the beating of the heart and can cause heart attack. Next would be to determine catheter placement by lowering the bag. What do you mean by that? If you're going to check dun sa pasyente, bakit hindi nagfo-flow kahit anong gawin mo? Try to see baka naman pala yung problema, yung mismong catheter. Baka naalis or na-dislodge yung mismong catheter or yung cannula ng ating IV dun sa blood vessel ng pasyente. So you will be able to determine that by getting the bag and you will lower the bag. And then, if you see a backflow, dun sa mismong IV site sa kamay ng pasyente natin, may makikita kayong backflow ng dugo. Ibig sabihin, it is patent. Nagkadikit yung cannula ng IV natin together with the blood vessel of our patient. Kung nag-backflow siya, then okay naman. It is patent. Try to look for other problems. You can also open the air vent just in case may problema pa rin sa drop ng fluids. In discontinuing and changing your IV solution bag, it's very important to take note that you have to verify that you have the right solution for the right patient. I remember one time we were having our duty dun sa BMC. It's a smaller hospital near your BGH. The nurse in charge, and I was the student nurse there, we were about to change the IV solution of our patient. In this case, before or 30 minutes bago kami magpapalit ng IV bag, yung ginawa namin ni ma'am nurse is that we check the IV solution. We put the label on the IV solution mismo. Binerify namin sa chart, binerify namin yung pangalan. So alam namin tama yung ginawa namin nung nag-prepare kami ng IV solution. So iniwan lang namin siya sa nurse's station. We were actually having our duty from 3 p.m. to 11 p.m. that time. Nung mismong time, napapalitan na namin yung IV solution ng pasyente namin kasi paubos na. We got the medication bag. Buti na lang, before we got inside the room of our patient, chinek ulit namin ni ma'am nurse. Pagka-check namin, ba't iba yung label, tapos iba mismo yung gamit naming IV solution. Buti na lang, dinouble check namin, pero alam namin previously na tama naman yung nakuha naming IV solution, tapos yung label, kasi dalawa pa kaming nag-verify. Baka dating ng kwakinyami, ijayhan mi nga amo. So what we did is that we had to get again the correct IV solution. So always remember this to ensure that you have the right IV solution for the right patient. So in this case, how are you going to check that? You're going to check the order of the physician together with the label and also your IV solution mismo during preparation. And the next, that is before giving it to the patient or before hooking the IV to the patient and upon entering the room of the patient. Para masigurado natin na tama yung binibigay natin sa pasyente. Please take note of that one. So of course, you're going to introduce yourself, identify the patient, and explain the procedure para alam rin ng pasyente natin kung ano yung i-expect nilang gagawin natin. Perform hand hygiene, and then just like in the previous discussion, you're going to open the bag, close the roller clamp of the infusion, yung unang infusion natin na meron sa pasyente, and then you're going to remove the plastic cover from the new IV solution tubing port. So again, alisin muna yung bag ng mismong, yung plastic containing the IV bag, and then you're going to remove yung blue na plastic dun sa may IV bag natin. And then you're going to remove the old na IV solution from the first na infusion set ng pasyente. Get the chamber, and then you're going to spike the new solution. So in this case, parang same lang sa IV spiking and priming natin kanina. And then, as usual, you're going to fill the drip chamber halfway or 1/3 full, and then check your IV tubing for any air. And re-regulate yung ating IV infusion. In your IV regulation, bibilangin ulit natin yung tamang drops natin per minute. This may also refer to what you call your IV titration. However, in the case of your IV titration kasi parang mas stricto yung pagbilang natin ng drops natin. And then make sure that you stick your label on the IV bag. Document the changing of your IV solution. There are also instances na nagkakaroon ng complication with our IV therapy. You have here common complications that may occur. We have infiltration, extravasation, phlebitis, and we also have here your hypersensitivity. In the case of your infiltration, what happens is that yung mismong catheter ng IV natin dun sa loob ng pasyente natin, it is dislodged or napunta siya sa maling area. Kasi dapat yung catheter nasa loob mismo ng blood vessel. In the case of your infiltration, yung catheter is outside of your blood vessel. So in this case, nagkakaroon ng leaking of fluid outside your blood vessels. You call this already your infiltration. Usually, in the case of your infiltration also, yung IV fluids na nakakalabas dun sa tissues ng pasyente natin would be what you call your non-vesicant IV fluids. Non-vesicant IV fluids will now refer to IV fluids that do not necessarily irritate or they would not cause severe destruction or injury to tissues in our body. In comparison with your extravasation kasi, in your extravasation, same rin yung mangyayari, nagkakaroon ng dislodgement or misplacement ng ating catheter outside of your blood vessel. But in addition to that, or yung fluid na binibigay natin sa patient are what you call your vesicants. Ibig sabihin, most likely they would irritate the tissues surrounding the blood vessels. So in this case, nagkakaroon ng complications in the skin surrounding your IV site. In the case of your infiltration, signs and symptoms would be swelling of the site kasi nga nag-accumulate ng fluid dun sa labas ng blood vessel natin. If you're going to touch the skin is cool. And when you're going to press over the skin, nagkakaroon ng parang white. The white discoloration when you're going to press over the area would now be what you call your blanching. Nagkakaroon din ng decreased or stopped flow rate. So we have here preventive ways and management for cases of infiltration. In the case of your extravasation naman, since vesicant yung medication, or yung fluid na binibigay sa pasyente, mas malala yung effect niya. So in this case, nagkakaroon ng necrosis or destruction of the tissues. We also have here your phlebitis naman. Phlebitis would simply refer to the inflammation of a vein. Sometimes it is related with the type of solution we're going to give to our patients. We have here examples are chemotherapeutic drugs. You will notice yung blood vessel kung saan dumadalo yung chemotherapeutic drug, nagkakaroon ng darkening or necrosis of the blood vessels. Sometimes it's because of the solution na binibigay natin sa kanila. So we have here the preventive measures and management for your phlebitis. You can just read on them. And then we also have here for hypersensitivity. This is in the case where the patient would now be allergic or would now cause an allergic reaction towards the fluid that we have infused to the patient. So in this case, you have to make sure na dapat chine-check natin ang pasyente natin for any allergies. Once nagkakaroon ng allergic reaction ng pasyente, immediately stop the infusion para hindi lalala yung allergic reaction. Infection naman in this case is a complication kung saan nagkakaroon ng invasion of pathogens into the IV site of the patient. So this could be a complication brought about by unsterile or unhygienic practices when you're going to prime and you're going to spike the IV bag. So those are the different ways on how we do our IV priming and discontinuing and changing of your solution bags. I will be sending you videos that will portray this procedure.